Hello, I'm Jane Williams and welcome to Webinar 6, Computer and Information Security. Country SAPHN acknowledges the traditional custodians of the lands we live and work on and pay respects to the elders, past, present and emerging. We recognise and respect the unique cultural and spiritual relationships to the land, waters and seas, which continue to be important to Aboriginal and Torres Strait Islander people today. The objectives are information technology and management, social media, business continuity. Information management. What is information management? Information management is protecting the process of collecting, storing, retrieving and distributing data. The management of that information is a key component of your practice efficiency and the quality of care delivered to patients. A good information management system ensures that the practice information is accurate, current and available. Effective management. The processes for effective management in general practice covers 3 key categories: collecting, storing and sharing information, informing and supporting decision-making and facilitating expertise, education and care from a distance. Some examples of technology available are electronic health records, secure message delivery, e-referrals, e-scripts, email, evidence databases, online journals, telehealth, virtual healthcare teams, e-learning, practice websites and social media. What is social media? Social media is defined as online social networks used to disseminate information through online social interactions. Social media makes it a convenient tool for general practice to connect with patients and health professionals. Staff must be educated on the risks of using social media. Information posted in their private capacity may reflect adversely on their professional capacity. Examples include abusive posts about a colleague or patient, friending and following a patient, finding and responding to a patient profile on dating websites. Social media policy in place, RACGP/AMA. Your practice must have a social media policy. A good social media policy is a living document that provides a guideline for your entire workforce's social media use. The RACGP and the AMA have information regarding social media and emails, and there are a number of websites which have templates to use for formatting your own policy. All the medical indemnity companies also have information available. A business continuity plan is in place to ensure that the practice is able to continue to deliver essential patient care and associated services in the face of a disruptive incident. The key objects of the plan are to provide basic information about the practice, including staff and core supplier contact information, provide an overview and prioritisation of essential services delivered by the practice to the patients and associated supporting functions, to outline and analyse known risks to delivery of these services, including reduction of risks where possible, to provide a framework for responding to any disruptive incident the practice faces and to identify some of the key actions staff can take in a disruptive incident. There are a number of websites which will help you to write a policy for your practice. Essentially, this would come into play if your server crashes. Without computer access, the practice can grind to a halt. Planning. Disaster box. Planning for such events will prevent chaos. A disaster box containing the following items will allow the practice to run whilst IT is managing the event. Include paper for doctors to use during consultations. These can be scanned into the patient notes at a later date. Prescription pads, authority prescription pads, workers' comp forms, Veterans Affairs Medicare forms, torches and private account forms can all be placed in your disaster box. Thank you for taking the time to join this webinar today. Country SAPHN gratefully acknowledges the financial and other support from the Australian Government Department of Health. For resources, you can email us at support@countrysapphn.com.au. Resources can also be found online at agpal.com.au and the 5th edition standards from the RACGP.